When doctors mention palliative care, many patients think it means giving up on treatment and preparing for death. That's an unfortunate misconception that too often prevents people from getting care that could significantly improve their quality of life. Palliative care is specialized medical care that's focused on relieving symptoms and improving quality of life for people with serious illnesses. You can receive it at the same time you're getting curative or life-extending treatment. Today, I want to explain what palliative care really is, how it's different from hospice, and why mesothelioma patients should consider it early in their diagnosis. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician and this is not medical advice, but understanding palliative care could help you access support that makes a real difference in your quality of life. So let's start by clearing up what palliative care is and isn't. Palliative care is specialized medical care that focuses on providing relief from symptoms and stress of serious illness. The goal is improving the quality of life for both the patient and the family. It's appropriate at any age and any stage of serious illness and can be provided alongside curative treatment. That last point is the most critical one. You don't have to stop cancer treatment to receive palliative care. You can be receiving chemotherapy, immunotherapy, or even pursuing aggressive surgery while also receiving palliative care support. It is not the same as hospice, though the two are often confused. Hospice is specifically for people who are near the end of life and have stopped curative treatment. Palliative care can begin at the time of diagnosis and continue throughout your illness, whether that's for months or for years. What does palliative care involve? A palliative care team typically includes physicians who specialize in palliative medicine, nurses with expertise in symptom management and support, social workers who help with emotional support and practical issues, chaplains or counselors for spiritual support if needed or desired, and sometimes pharmacists, nutritionists, or other specialists. Now, before I go on, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, let's take a look at how palliative care works. The palliative care team works alongside your oncology team. Your oncologist will continue to manage your cancer treatment while the palliative care team focuses on managing symptoms, helping you cope with stress and emotional challenges, facilitating communication between you and your medical team, helping clarify your treatment goals and preferences, coordinating care across different specialists, and providing support to your family members. For mesothelioma specifically, palliative care can address shortness of breath through medications, oxygen therapy, positioning techniques, breathing exercises, and treatment of pleural effusion. They can also provide pain management using various medications, nerve blocks, radiation for painful areas, and non-medication approaches. The list of palliative care offerings is long. They can help with fatigue management through energy conservation strategies, treatment of contributing factors like anemia, gentle exercise programs, and addressing sleep problems. Nutritional support is another area of expertise, especially when appetite is poor or eating is difficult. Nausea and digestive symptom management, anxiety and depression treatment through counseling, medications, or both, and advanced care planning discussions about your wishes for future care. Research has shown that palliative care significantly improves the quality of life for cancer patients. Studies have found that patients receiving palliative care report better symptom control, less anxiety and depression, better communication with doctors, and higher satisfaction with care. Some studies even suggest that early palliative care might help patients live longer, possibly because better symptom management allows them to tolerate their cancer treatment better. When should you start palliative care? The ideal time is right after diagnosis. You don't need to wait until your symptoms are severe or your treatment has stopped working. Early palliative care establishes relationships with the team, sets up support systems before crisis moments, addresses symptoms when they're easier to manage, and helps you think through your goals and preferences while you're feeling relatively well. Many cancer centers now offer palliative care consultations to newly diagnosed patients automatically. If your center doesn't, you can request a palliative care consultation. How do you access palliative care? Ask your oncologist for a referral to the palliative care team at your cancer center. Most major cancer centers have palliative care services. If you're being treated at a community hospital, ask if they have palliative care services or if they can refer you to a community-based palliative care program. Some areas have home-based palliative care programs that provide services in your home. What happens at a palliative care appointment? The initial visit is usually 60 to 90 minutes. The team will ask you detailed questions about your symptoms, how you're functioning day to day, your emotional state, what concerns you the most, what are your goals for treatment and life, what support systems do you have, and what you understand about your illness and your prognosis. They'll review your medications and they might suggest changes to better manage your symptoms. They'll discuss your preferences for communication and decision-making. Follow-up visits can be in person or they can be done on the phone or over online. They focus on how you're doing with symptom management and any new concerns. Does palliative care mean you're giving up hope? Absolutely not. Hope takes many forms beyond cure. You can hope for good quality of life, meaningful time with family, symptoms that are well controlled, the ability to attend important events, a peaceful and comfortable end of life when that time comes, and many other things. Palliative care helps you identify what you're hoping for and then works towards those goals. Now, what about cost? Most health insurance, including Medicare and Medicaid, covers palliative care services. Since palliative care is medical treatment rather than simply counseling or support, it's generally covered in the same way that other medical services are. What if you're hesitant about palliative care? Some patients worry that accepting palliative care means admitting their situation is hopeless or that doctors are giving up on them. Neither of those things is true. Palliative care is about living as well as possible with a serious illness. It's compatible with aggressive treatment and with hope. If you're unsure, try meeting with the palliative care team just once. You're not committing to anything long-term. See if their input helps. Many patients who were initially reluctant find palliative care invaluable once they understand what it actually involves. How is palliative care different from what your oncologist provides? Your oncologist focuses on treating the cancer, choosing chemotherapy regimens, monitoring tumor response, and adjusting treatment when needed. They also do address symptoms, but their primary focus is cancer treatment. By contrast, palliative care specialists focus specifically on symptoms, quality of life, and helping you navigate the experience of serious illness. They often have more time for in-depth conversations about goals and concerns. They bring specialized expertise in complex symptom management. The two approaches complement each other. To review, palliative care is specialized medical care that's focused on relieving symptoms and improving quality of life for people with serious illnesses like mesothelioma. It's provided alongside curative treatment, not instead of it, and it's different from hospice. Palliative care teams address pain, shortness of breath, fatigue, and emotional distress. They also help with communication and planning. Research shows that it improves quality of life and satisfaction with care. So start soon after diagnosis rather than waiting until your symptoms are severe. You can visit mesothelioma.net for information about palliative care and symptom management, or call our patient advocates at 1-800-692-8608, or use the live chat feature on our website to speak to one of our patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.